In this PowerPoint, we will discuss rashes associated with pathologic perforators. This is not an uncommon occurrence. Working in a large dermatological practice, we are often consulted for evaluation of the venous system in those patients who present with eczema-type rashes that are persistent even after appropriate therapy. Often, there is a clue for venous insufficiency, such as skin changes, or varicosities, or swelling. Many times, there is no evidence of venous disease or no varicosities, spider veins, swelling. The patients just present with isolated eczema. When you see isolated eczema on one lower leg, you must assume, if this eczema is persistent, that there may be some venous involvement. This can be from a perforator, greater saphenous insufficiency, incompetent reticular vein, etc. In this case, this patient had topical treatment for 2 years before she was referred for venous ultrasound. Now you can see this isolated area of eczema right here. It's been here for 2 years. Saphenous is normal, but I'm going to show you she has a perforator right here. This may be the responsible etiology for all this. So we're going to do ultrasound-guided injection eventually. Close it off, see if we can relieve this. Here's the perforator coming up right here, a muscle perforator. And you can see it connects right there. I'm going to turn this on color. This is the only pathology I find in this area. It's this perforator. It's right there. And this goes into the superficial vessel there. And she has some reticular veins further on out up the top. You can see. You can see there's reflux there too. So we have to assume this is the problem. All right. Now note the improvement that this patient had with compression only and Dermica cream. This patient was compliant for about 1 month after her initial visit until she saw us again and wearing her compression hose. This is a really good indication that she will get a good result from perforator ablation with foam sclerotherapy. Now you can see the excellent result after foam sclerotherapy. This was done by ultrasound guidance. We actually cannulated the superficial reticular vein and then did retrograde injection into the perforator. You'll know on the right side that there's spasm of the perforator. In fact, you can't even see it now after the foam injection. She will wear compression for about 2 days after this, and we will see her in follow-up in about 1 month. Just keep in mind that isolated eczema is not uncommon in venous disease, especially if you have no other symptoms except eczema. It may be difficult to diagnose unless you do a thorough ultrasound. For people with eczema with varicosities, it's kind of easy to diagnose what the etiology is. But when you see patients that have persistent eczema in the lower legs, especially on one leg, I really had to be aware that this could be isolated pathologic perforator incompetence. And we see this maybe 2 to 3 times every quarter in our practice. We probably see anywhere from 10 to 12 patients a year that present only with eczema, no evidence of venous disease, and they have a pathologic perforator.